do feel like there is a difficulty to find providers who are willing to come into a rural area.
Seeing a doctor in an emergency or just for a regular visit might be easy in a city like Chattanooga.
But if you're outside the city, that can be a struggle and one that impacts the health of the people in those areas. Thanks for watching. I'm Josh Rowe.
And I'm Latricia Thomas. Now, this map shows the healthcare shortages for people on TennCare and primary health care. It includes Polk, Ray, Bradley counties, as well as Marion.
Now, at least one U.S. lawmaker wants to make things easier and more affordable. News Channel 9's Chrissy Calcagno explains how it would help with pay for those workers as well.
Thank you for calling Benton Family Health Care. This is Ginger. How may I help you?
Just off Highway 411 in Benton. This nonprofit helps more than 9,000 people a year who don't have easy access to health care.
Got you down for 10:15 on Monday.
And oftentimes we're meeting a patient at their most critical moment. And so providing as much service as we can is really paramount, because a lot of these individuals, they're coming to us through geographical barriers or financial barriers.
But the Ocoee Regional Health Corporation says the primary care they provide isn't just about geography.
We're looking for medically underserved populations, and that population doesn't necessarily have to be in a rural community. That population can be anywhere where medical needs are not being met because the service is not available.
So take a look at this map right here. This shows where the primary care health resource shortage is the most. In our viewing area, you can see in blue, we have Marion, Bradley, and Ray counties. That's where we're seeing the most shortage.
Being able to attract people into a rural area and then allow that access to health care. What follows that is growth in population, economic development, and economic growth.
Now there's a push for extra help. That's the goal of U.S. Senator Marsha Blackburn's Rural Health Plan. She's supporting an incentive for medical professionals to come practice in a rural area. If they do, then their student loans will be forgiven.
Maybe through federal grants, maybe through partnerships. How can we solve this problem?
A problem that hits home.
Thank you, and you have a blessed day.
The biggest problem in keeping rural hospitals open is that many of the patients are uninsured or unable to pay. So would accepting and expanding Medicaid save the rural hospitals? Well, this depends on who you ask. Tennessee rural hospitals are closing left and right.
We're not providing the medical care in rural communities that they need.
That's why Judy Reutman and her team at the Tennessee Healthcare Campaign spoke with communities and did research to figure out why Tennessee has the highest number of rural hospital closures per capita in the nation.
The main thing I want to say is that rural hospitals are drowning under uncompensated care. They are required to see patients who show up sick at their doors, but there's too many people who have no insurance at all.
That's why Reutman says Tennessee needs to expand Medicaid and accept federal funding.
They just don't get the primary care, the preventative care that keeps them out of hospitals.
Dr. Mark Gaylord, retired director of the NICU at the University of Tennessee, says this is a critical time to expand Medicaid.
One of the things that happened with COVID is that people could not be kicked off of Medicaid, and we're getting ready to be in the Medicaid enrollment portion. And there's an estimated over 300,000 Tennesseans that are going to be kicked off Medicaid.
Dr. Gaylord adds it's the main reason why so many hospitals have failed or are failing in Tennessee.
I would like this to be a much more free market.
We went to Senator Mark Pody, who's been involved in finding ways to expand health care in rural areas, and asked him if he would accept federal funds for Medicaid expansion.
They give so many strings and restrictions, we don't always get that bottom money.
Senator Pody believes that government is too involved in the medical field and emphasizes it's a detriment to healthcare in rural communities.
What are you going to do as state senator to increase the access to healthcare for rural communities?
Anything we can do to help cut down some of the regulations that we have, I am all for it. And there are several areas that we can be addressing. One of them is something called the Certificate of Need opportunities, where some physicians would like to or people would like to open up some more medical practices.
Senator Marsha Blackburn says that she and Senator Dick Durbin of Illinois have been working in a bipartisan manner on this issue.
Making certain that we are getting providers into rural areas, making certain that there are options on the table that rural communities can use to bring that emergency care that they need.
The lack of Medicaid expansion in our state has impacted rural communities.
Tracy Stansberry, who's worked in rural healthcare for 20 years, says these changes need to happen now.
Not only does a rural hospital decrease access to care, but it also decreases the economic vitality of a community, which then has an ongoing spiraling effect.
So she explains it keeps industries and businesses away from these rural communities, which she emphasizes ultimately widens the gap and makes these communities even poorer and less educated.
Some members of the Tennessee Healthcare Campaign also believe that hospitals should be required to provide communities with annual reports and notify them in advance of significant changes in services.